You're listening to the Business Spotlight podcast presented by the Lancaster Fairfield County Chamber of Commerce. I'm Logan Weaver, the marketing coordinator for the chamber. Thanks for tuning in. Today, I have the CEO of Fairfield Medical Center, Jack Janoso. How's it going, Jack?
I'm well. Thank you for having us today.
Tell me a little bit about your role with Fairfield Medical Center.
Well, Logan, my role as CEO is a very important one to me, and I'm very blessed to have this role. So I've been in the community now for a little over 9 years, and I've been the CEO of Fairfield Medical Center since 2014. And the uniqueness of my role is that when I came to this community, I was brought here to perpetuate the very deliberate care that this community has always had from an organization such as FMC, and to see it grow and thrive and prosper. And I've been very fortunate to work with a lot of very committed members of our board who are local community citizens who care greatly. Those are volunteer positions. They get paid nothing other than food and time. And we've been very fortunate to have their direction to ensure that this community is always benefited by having the best possible care closest to home.
Obviously, in those 10 years of you being CEO, a lot has changed in the world of healthcare. Obviously, we've been through and still coming out of COVID and everything. We've got, changes with FMC itself during that time, a new campus and everything. What has been the most interesting change that you have seen from your perspective as the CEO over the last decade?
Well, it's interesting that, in the 108 to 109 years of FMC's existence in this community, it's gone through varieties of different changes. It's grown tremendously. Over the last 9 years, we began starting with expanding our footprint to include more of our growing community. We fixated on our River Valley campus being an extension of what traditionally has been the hospital as the hub of medical care. Healthcare has changed enough in the fact that we need to be more present in outpatient venues. So when we started thinking about the campus of River Valley, it was to do two things. It was to put community services closer to where people are living now versus where they were living even 20, 30 years ago. As our community continues to expand, there was a lot of blank space between us and the periphery of our community that really left a lot of opportunity for people to choose other options and go other places because we weren't as close to them as we could be. So when we talked about building that campus, we wanted to obviously create community space, create a place where people could come and not have to be sick. They could come, and our collaboration with the YMCA has been a very great addition there. So people could use it as a health maintenance facility. They could use it to improve their well-being, but they could also use the community rooms. But we've also decided that, when we talked about advancing therapeutic options and outpatient options, having more emergency room capacity, because emergency department volumes have done nothing but increase. Absent of a few, periods during the pandemic when everything decreased, we've seen nothing but emergency room growth. So we wanted to make sure that we had the ability to meet that capacity demand. Adding, more outpatient therapies so that people can get the care that they need in a venue that's probably more attainable to having an adjunct facility to continue your therapy once you're done with your therapy at the Y. And so we put a lot of deliberate thought into trying to move things away from the hospital that made sense for the people in our community. We've also invested a lot in putting family practice and primary care physicians in communities that we support and serve that aren't in Lancaster. Our development, Amanda, to build an outpatient space there that allows our physicians to have access to those communities. We've expanded into Perry County, into New Lexington, and a lot of great collaborative work we've done with Hocking Valley Community Hospital to expand even services into Logan to help support them. They're a different size hospital than us, so some of our specialists are the closest thing they have to specialized care, so we're very happy to build those relationships. But change has been constant, and I will tell you that in the last 5 years in particular, we've been through every amount of business challenge you could imagine. I mean, were impacted hugely by the pandemic, but for my people, there was no sheltering at home. It was prepare for the worst, deal with the worst.
Because you guys were the front line, yeah.
Front line, midline, back line. And, the last several years have been about cleaning up after the pandemic.
Mm-hmm.
One of the things that people don't recognize is that when the pandemic broke out, we had to literally stop everything and rewire it to support something that was completely undefined. There was no manual for it. We had no playbook. every other day the rules would change. Every other day the challenges would change. And then the business issues came as a result. People sheltered at home. Our business dropped to near nothing for a period of months, which is not good for a business our size. Then all of a sudden everybody came back in one fell swoop. And, then now you have pandemic-related illness, you have normal community illness, you have to balance that equation. Then afterward, we started to see our very tired, very worn-out people start to retire, ease out. And across healthcare in general, there's been a loss of a lot of the support mechanisms and the people that we've traditionally counted on. So we've been rebuilding, retraining, rehiring, rewiring, and putting the organization back together now for the last 2 years. And it's finally starting to feel for us like a normal operating environment again. But it's all the while we've continued to focus on building a high-touch organization with high-quality care, never letting that slip, building great relationships with our people, and really fixating on a culture that really does support the type of care that we hope that everybody gets from us, which is what you would expect for friends, family, and neighbors. We believe that that's the mark of our trust with the community. If we can't do the job exceedingly well, there's too many choices now.
Right. Especially, during that pandemic, I don't envy you guys or anyone who had to go through that, especially, like you said, the front line, midline, back line, seeing that from an entirely different perspective than what probably 90% of the population had to experience. But the fact that you guys were able to hold strong and keep going through it, and now you're coming out of it and trying to, as you said, kind of rebuild. It's almost like a new era in FMC. Kind of the pandemic was kind of the changing of the guard. Now, as you're entering a new era, learning new things from the pandemic and everything that comes from it, I think that's pretty interesting to hear that you guys are continuing to adapt, whether it is a global pandemic or even just day-to-day operations. Just being able to stay consistent and continuously adapt at the same time, I think is good.
We've had to assimilate to a lot of organizational challenges, but what I will tell you is that we've never not found the right answer. And it really does speak to the people. When I think about the physicians that we have at Fairfield Medical Center, the staff that we have, the people that we've been able to bring into an organization with a very deliberate culture built around care, kindness, and respect, by and large. And we're no different than any other organization. Occasionally things don't go perfectly. But by and large, what I have seen is the organization has gotten back to a position of vibrance. And even at our worst, even during some of the darkest, most horrid days, we all just carried each other through it. And I'm really proud of what I've seen the organization do to respond to a challenge that none of us asked for, no one could define, and no one really could control. We've worked through it. We've done a good job. As we look to the future, we still have an eye toward growth. We have to continue to grow. I think as our region changes and as our community changes, we have to be able to adapt and change with it and grow with it to ensure that for the next 100 years, we're still going to be here doing the things that you need us to do so that you don't have to get in your car and travel 20, 30, 40, 50 miles for the care that you need. We could do that well here.
And especially as someone like myself who grew up in a very, very rural community, I know people say that Lancaster is part of a rural community, which it is. But for those who, like you said, reaching out into like the Perry counties and the Hocking counties, where maybe if the healthcare isn't immediately available right then and there in their own backyard, you've got that 30, 40, 50-minute drive, which for some people could be critical in a life or death situation, almost literally. So being able to expand and have that presence and help these neighboring communities is also a big benefit too. And it kind of goes with your point on the expansion and dedicated to not just your local community, but the region as a whole. Something that you guys, as you mentioned, have been doing for over 100 years. And part of that expansion just a few years ago was the River Valley campus. How has that benefited you guys, not just here in Lancaster, but for the surrounding region?
Well, I think even if you look at it just from a small perspective, from the fact that we added more emergency department capacity, when I first came to FMC, it was pretty typical that on any given day there would be 3, 4, 5 hour, 6 hour waits for emergency care because there's just so much space to fill. And when people come, our physicians handle things in terms of who's the sickest and who needs the most critical attention, so that if you have an emergent need, but maybe it's not as emergent as the people being cared for, you literally sit and wait. By being able to kind of bifurcate and create more capacity, it's allowed us to better manage those wait times and to be more attentive to customers' needs, but still provide them great emergency care. our emergency departments work simultaneously with each other. It's not like one does one thing, one does another. They work very collaboratively. That's helped a lot. Moving outpatient diagnostics to one location so that if you need an MRI or a CT, instead of going to, I think we had things spread out all over the community. Now it's in one very easily accessible location with ample parking and adequate space. So we're able to accommodate your needs a lot more efficiently. Moving a dedicated women's center to River Valley was a good thing because not all those things need to happen in the walls of the hospital, which is the hardest place to navigate. Parking's not easily convenient at times. We've tried to do our best to make it better, but you're dealing with old physical space that has continued to grow. So it gave us a chance to take a fresh look at being able to provide services to our community in a different way, and I think it's served its purpose exceedingly well. 5 years in, we are so blessed and so pleased that the River Valley campus has done more than we ever anticipated it doing.
Like a lot of small communities like Lancaster, if it's not the school district that's the largest employer, it's the healthcare system, and you guys are the largest employer here in Lancaster and Fairfield County. So kind of tell us about what it is that you guys do to make yourselves such a great place to work and why you guys are attracting more and more talent every single day.
Well, I appreciate that. We take that mantle very seriously. We understand that, for the 2,000 plus people that are part of our FMC family, that we start by considering it a family. We have built a very deliberate culture there, and it's really based upon allowing people to rise to their fullest potential. We don't necessarily believe in titles and hierarchy. We give everybody equitable chance to make a lasting impression on the people that they come in contact with. We put a lot of deference to the people who are at the front lines touching and caring for and dealing with our patients every day. They're the ones who really matter. So the last thing we've tried to do is lean heavily on hierarchy. For instance, our environmental services people who clean our rooms, keep our facility looking spanking clean. Cleanest place I've ever been. They put a lot of pride in what they do, but they're not in it alone. Our staff understand that if they see something that they could do to help keep our appearance looking well, that everybody bends an elbow, everybody chips in. There's a very strong measure of teamwork that we've been able to build. There are no silos. Our clinical teams work simultaneously with each other to make sure the right thing always happens. We've been able to build that camaraderie in a way that I've never seen before in any place I've been before. And it's because I think we've really gone back to looking for the right people, finding people with big hearts, big brains, but it's easier to find someone who's aligned with your culture and train them to do things the way you want them to than to try to take someone who's very good at what they do who really can't buy into a team atmosphere. And we've learned how to just really celebrate our people. And I think it's helped us get through great times really well, and it's helped us get through really tough times better.
And I agree. And especially, I see your name tag here where you guys were just recently named, probably within the last 5 years, one of the top workplaces in the Columbus, Central Ohio market. And when you consider, the amount of healthcare organizations that are in the Columbus area, especially with OSU and other entities that have such a big footprint, seeing that for a smaller yet powerful organization like that in a community like this, I think really speaks volumes to, the workplace and the culture that you guys have been able to create.
I appreciate that. That workplace designation is based upon our people's engagement, and engagement is really a function of not just coming to work and doing your job and showing up, but how engaged are you in making the place a better place to be, making sure that if we see an opportunity to succeed, that we embrace it. The one thing we've learned, too, is that, our success is fed by consuming our failures. The consumption of our failures means that we're willing to talk about the things that don't go right so that we can fix them and make them better. And I'm really proud of the organization for taking that approach to challenging itself every day to become even better at what they do. And that's been something that's been very empowering to me. It's inspiring to me to see our people always want to figure out from the patient's perspective how we could do the job better. And that's our motivation to succeed. And, that carries through to ideas that we have to grow. It carries through to how people feel about their jobs. And quite frankly, it's an awesome place to be. I can't think of, there were a few days in the pandemic that weren't super awesome, but I will tell you, by and large, I look forward to coming to my job every day and seeing the people I work with. It's like coming to family every day. It's not really like a job. And hard for me to describe, but it's been a pleasure. And quite frankly, I'm really proud of what this organization stands for and how it's stood up.
Yeah, and I think it's really shown in the community, whether it's, folks looking for employment with you guys, the folks that we have worked with here at the Chamber, whether it's you guys, the foundation, or whoever that we come across that is tied to FMC. Nothing but good things really to say. I know, just a quick story to share. I know Alan Greenslade with FMC is on our board of directors, and part of our assignments for our board directors is new member mentorship, and he was assigned to, I believe it was WITS down here in downtown. He was so excited that he got to participate with that. So seeing that dedication, not just for the community, but also the small business community as well, was pretty cool to see.
Well, it's, as the largest employer in the county, we believe that if we don't show care and concern for our community, then why should the community have any care or concern for us? So you will see us very prevalent and present in community events. We look forward to the holiday parades. We love being engaged with the festival. I personally have been part of the festival now for going on 9 years, and I've loved every second of it. I mean, for us to have an event like that in this community is just still mind-numbingly awesome to me, that we could have it's been going on for 35 years, and it's just such a blessing to all of us. So, we believe in being present. We believe that, our time to give back to the community is as important as the community trusting us for care. If you're not here, then you're just taking, not giving. So we plan on being as present in the community as the community will tolerate.
Yep, and I want to commend you and your team as well, because anytime we have a ribbon cutting, even if it's not for an FMC-related project, usually it's a lot of the healthcare-oriented projects. I know, some of the rehab facilities that are coming into town, these are potential partners that are moving into the community that you guys have opened your arms to, because, being able to work with these types of entities benefits everyone, not just you, both organizations, but the community in general.
Well, we believe that building relationships is fundamental. This is a very relational community. We're very relational people. And, as sophisticated as we become, we can't do everything for everyone. So those relationships matter to us. For instance, the rehab hospital coming into town is a good adjunct for us, because that's not something that we do. When patients leave our acute facility, they need places to go where we can build relationships to know that they're going to get good follow-up care, so that they don't end up back in our emergency room or back in an acute care facility. So it's important for us to be present and to collaborate with, it's not just that specific instance. I mean, it's our skilled facilities in the community. Fairhope is a great partner. Hocking Valley Community Hospital in Logan is a great partner for us. We believe in partnering wherever we can, regardless of whether they're flying an FMC flag or not, because it's better for our patients.
That's Jack Janoso, CEO of Fairfield Medical Center. Jack, thanks for coming in today and talking with us on the podcast.
Logan, thank you for having me. Anytime.
You've been listening to the Business Spotlight podcast presented by the Lancaster Fairfield County Chamber of Commerce.